Habari zenu, this is Mutuku Fred, and Mutuku Fred is a public health officer. Currently, the doctors are on strike, the clinical officers are on strike, the medical laboratory officers are on strike, and the unions are serious about them. And the reality is that doctors are paid on internship, like a medical officer intern who know they are calling a junior doctor is paid Kenya shillings 200,000. That's someone who has just completed studies, graduated, and is going for the mandatory internship so that to get licensed. Mtu analipwa 200k, and the unfortunate bit is when a public health officer is sending the service as the premium or the main level, which is the assistant public health officer, that person is paid just around 80,000 Kenya shillings, and degree public health officer who is entering the service is paid almost 80,000 Kenya shillings. And this is a person who is expected to deliver, who is expected to survey students, a person who is expected to be the pillar of preventive health services in Kenya. And the most unfortunate bit is since 1999, PHOs have been going for internship. Many will be surprised because only this treatment before PHOs came in 2014, it only used to go to the degree public health officers who were not at the decision-making table. You would go for 1 year unpaid mandatory internship for you to be given a certificate of competence, for the system to accept you as a PHO, the system that has trained you, the system that you are paid to. For it to accept you, you had to go a discriminatory internship where the diploma public health officers, majority of them from the KMTs, didn't go through that. And I'm sure majority of my seniors are still traumatized because of that discrimination, where the diploma didn't go through that internship, but the degrees went through it. But they still made it alive. Majority of them are big in the NGOs, but they're still struggling because without the good public health policies for the PHO to work better, we still have a problem. Now come to 2014. So 2013, that is, PHOs came in. Their responsibility is to regulate the training and the practice of a public officer. Luckily, and as a blessing, they put it mandatory for the diploma and the degree public officer to go through internship. Unfortunately, 8 years later, those PHO interns are not paid, and I think this is a big crisis that harms our young public health officers, who we call them PHOs. Already, when starting in the system, you're already being discriminated. For example, you go to a good university, you find the degree pharmacists from that university are paid for internship. They are paid 200,000 Kenya shillings. You are paid zero as a degree public health officer. The medical officer students from that university are paid for internship. The degree clinical medicine students are paid for internship. The clinical medicine students from that university are paid stipend, which was previously 50,000. They fought for it, and now it has been doubled. The BSc nursing students from that institution will be paid for their internship. Unfortunately, if you start discriminating the PHO from that level, is very much unfortunate, because as a PHO, you're expected to go to NEMA, you expect to go to the occupational health offices which are under national government, you expect to go to the port health. And the unfortunate bit is, as a public health intern, you are only posted to counties. That meaning there's zero innovation. According to the PHOs internship guidelines, there are around 6 to 7 areas where you should be posted, including NGOs, including national government offices, including ports, including so many other areas. But unfortunately, only counties are counted as internship centers. So the unfortunate bit is a PHO, they are forcing you to only be employed by the counties because that's where you rehearse. And the failure to accredit the other areas means that PHOs can't sell themselves even if they are unpaid. So at the end of the day, you will end up being just restricted to one area. At least now there's a plan to accredit the ports to be internship centers, and I think that would be better. But I think public health interns deserve being paid for the internship just as the others, because these are not lesser professionals. At least for the certificate, public health students, they don't go for internship, but for the diploma, just the same way the clinical officer intern is paid for internship, the same treatment should go to the diploma PHO. Discrimination has no room for the Kenya of 2024. The same way the BC PHO has suffered for so much since 1999, going through unpaid internship, and the government, our divisions in APHOs have not seen it necessary for internship to be paid. At least our registrar of the PHOTC, Wainaina, wrote to the Director General MOH, who is a medical officer, to ensure that public health officer interns are included. I included the postings for interns by the APHOs, and they are paid. Thank you for that, but we still need more. Currently, doctors, the main reasons why they went on strike is about the medical officer interns or the doctor interns. We deserve better as public officers, and the only way we can do it, we call upon APHOK to support APHOs to post and pay our interns. Being on unpaid internship since 1999 is so very much unfair. It kills the morale of the profession. It demoralizes the young public health officers. We call upon our union, KEHPHPU, do more. We are not lesser. We have subscribed to you. And lastly, I call upon the young public health officers. We are the people who will suffer if you stay silent. Keep talking. Use platforms like Facebook, X, TikTok, and WhatsApp to speak truth to what is needed. Just like late TJ Kajwang said. Is it TJ? The late Senator Kajwang said, bado mapambano. Just imagine, doctors are paid the rest what we are paid, but they're still going on strike to get better. We deserve better, and that better starts with the young public health officer who is a public health intern being posted by the Ministry of Health and being paid while being an intern. We have suffered for long. That should end. Call to action, pay the PHOI. Thank you for coming to my TED Talk. Bye.